Hey everybody, today's quick sketch is going to be about osteochondritis dissecans of the shoulder joint. We're going to pick the shoulder joint because that's a pretty common site for this, also referred to as with the acronym OCD. So to begin with, we're going to set up our orientations. Here we're going to sketch our normal shoulder joint, and again we're going to do the shoulder joint because this is a common site. And this shoulder joint will be OCD. We're going to do this from a lateral view. So we also have to draw our dog head. Okay, and the tail's over here for both joints. And to begin with, we'll draw our humera, or scapula, excuse me. So we'll bring it down, draw a nice rounded glenoid cavity, bring it up, have a nice acromion in there, and we'll do the same for the OCG joint. So we'll draw a couple scapulas here. Then we'll continue to draw the humerus, and we'll begin with the humeral head in the normal dog. So you can see that this is a nice rounded humeral head, fits in well with the glenoid cavity. We'll complete with the greater tubercle and kind of put it down there. So that's a really nice fit, a nice joint. This dog is happy, fetching, running, etc. Now let's consider what the humeral head might look like in a dog with OCD. And we'll bring our humeral head in here, and we'll put a concavity in here, make it look a little jagged or not as smooth, and we'll complete our drawing here with the greater tubercle. Alright, so we'll even include in here is a flap of cartilage coming in here, and this by definition, this concavity and this flap of cartilage would be referred to as osteochondritis dissecans, or OCD. That's a condition in which a piece of articular cartilage becomes fully or partially detached from the surface of a bone within a synovial joint. And the other thing to think about is that OCD is a result of an underlying disease called osteochondrosis. So if we were to just complete our drawing here, if you think about osteochondrosis during secondary ossification here in the extremity, the proximal extremity of the humerus, for example, osteochondrosis can occur when the endochondral ossification in this that's forming the bone that's forming within this aspect of the bone during secondary ossification fails to change, and this fails to occur properly within a single spot, and the cartilage in this area it can become thickened, and this area of thickened cartilage is poorly nourished by joint fluid and prone to fragmentation with normal activity. So really, when you think about this, to organize it in your head, the disease is referred to as osteochondrosis until the fragmentation or the creation of the flap, and then the term OCD, or osteochondritis dissecans, is used. And remember, dissecans equals dissected.